And now, Rowan Radio 89.7 WGLS-FM proudly presents Your Health Matters. Your Health Matters is a weekly program that features interviews with local and national physicians about relevant health issues. This program is intended for general information purposes only. It is not a substitute for medical care. Please discuss this information and any questions with your family physician. And now, here's your host, Dr. Craig Wax.
Welcome to Your Health Matters. I'm your host, local family physician, Dr. Craig Wax. Today's show is very important because we're talking about the patient-physician relationship, what the importance of it is, why it exists, how you can improve it, and what's being done right now to potentially destroy it. Our special guest today is Dr. Jane Orient, who is an internal medicine physician out in the Arizona area and who is the executive director of the AAPS. And I'll let Dr. Orient tell you a little bit about that. Welcome, Dr. Orient.
Well, thank you for having me. The AAPS is the Association of American Physicians and Surgeons that was founded in 1943 to promote the sanctity of the patient-physician relationship and to fight for freedom in medicine and to make sure that we have our priorities straight, that our patient is our number one priority. It is the reason that we practice medicine.
I see. Very, very important. I feel the same way in my practice. I go to work every day to try to help somebody, and certainly making a living is second. It's somewhat important because if you can't make a living, then who can help the patient? And there's a lot of things and issues right now about the physician-patient relationship that have changed in the decades that you've practiced.
Indeed, they have. In fact, the very ethical foundations of medicine are changing, at least from the perception of academics and other important people.
Wow. So what are the important concepts in the physician-patient relationship, or the patient-physician relationship, as you so correctly put it? What are the important points in summary?
Well, first, the physician should be working for the patient. And according to the oaths of Hippocrates, his duty is to prescribe regimen for the good of the patient, according to my ability and my judgment, and never do harm to anyone. You may think that that's pretty basic and fundamental, but if you look at all of these new oaths that are being used in medical schools throughout the country, even the do no harm has been lost. The my ability and my judgment has been lost. You're supposed to be going by best practices defined by somebody else. And the importance of the patient is subservient to the third party, to the government, to the collective, to society, to somebody else. And the very sanctity of the individual patient relationship is being lost.
So what you're saying is the first principle would be to work for the patient, the good of the patient. The second principle is to do no harm, as mentioned in the Oath of Hippocrates. And the third principle would be that the patient-physician relationship is subservient to no one, not government unfunded mandates, not insurance company rules and structures.
Exactly. And the decision maker, the medical decision maker, needs to be the patient. The patient has the right to seek the care that he wants, and he has the right to decline the care that he doesn't want, even if it's recommended by his physician. But he is not going to be able to exercise that right unless he also has control of his own money. What has happened is that so many patients have turned over a big chunk of money to the third-party payer, which promises to pay for all necessary medical care, but then it defines what's necessary, and it prioritizes things. And the patient's money has just disappeared into the big pot, and he might as well kiss it goodbye, and he has no control over the decisions made by the third party.
And that's a very important point. We should take a short break and come back to talk more about the patient-physician relationship with Dr. Jane Orient of AAPS after these messages here at 89.7 WGLS-FM. Welcome back to Your Health Matters. I'm your host, local family physician, Dr. Craig Wax, talking today about the patient-physician relationship. Our special guest expert today is Dr. Jane Orient, who is an internal medicine physician out in the Arizona area, and she is the executive director of the AAPS. Welcome back, Dr. Orient.
Thank you.
Our pleasure indeed. Thank you for telling us a little bit about your take on the physician, or I should say patient-physician relationship. Sorry, I shouldn't put physicians first because patients are always first, and I think that's an important thing.
Yes, it's important to remember, and it's very difficult these days.
Yeah, certainly, because, when you're in the exam room with the patient, there's a lot of external noise and confusion and requests and demands and even blatant no's that come from different private and public entities. So I'd like to spend some time talking about insurance intrusions in medicine and then coming on to government intrusions in medicine. Can you tell us about insurance intrusions into medicine?
Well, let's first talk about what insurance is supposed to be and
Sure.
what it used to be in medicine and what it is in casualty insurance, like automobile insurance and homeowners insurance. It is a contract between the insured individual, the subscriber, and the insurance company. And in return for paying a premium, the insurance company promises to reimburse you for a financial loss. If your house burns down, if your car gets wrecked, they give you money according to the terms of some contract. But with health insurance, it's turned into something entirely different. Oftentimes the insurance company is paying the physician, now called a provider, directly. And this means that the insurance company has become the customer. The real customer, he's the one that writes the check. It's really an it, is what the physician has to please. The physician gets paid for filling out a claims form appropriately, not for making a patient feel better.
I see. So what you're saying is the relationship is supposed to be all about the patient, but the pay is coming from a third party, and the third-party intrusions begin when the patient registers, and you have to have your staff check to see if they're eligible for a service at all, if they have a copay or a deductible, and whatever the details are that really even aren't physician or health system details.
Well, you find out about this when you first call the office. A lot of times the first question they ask is what type of insurance you have, not how may we help you.
Wow, and that's a big change in the years you've practiced.
It really is. I mean, it used to be 40 or 50 years ago that patients paid the bill, and then they filed the claim with their insurance company, and they got the check. And now it's sort of assumed that the doctor will pay, or will file the claim, and the insurance company will pay the provider or supplier rather than the person who paid the premium on the insurance policy. And this gets everything upside down and backwards. It puts in all types of incentives for corruption, all types of just misplaced priorities. And I really think this third-party payment system is at the root of most of the problems that we have, starting with the problems of escalating costs.
Right. Certainly, because all the insurers feel because they potentially bring patients opportunity to see you, that they all want a discount and they want the minimum possible price. And unfortunately, sometimes the minimum possible price paid can get you the minimum possible service as opposed to what you need or want.
That's about it. I know I had one patient one time who said, I can't come see you anymore because you're not on my plan. And I said, well, sure, you can come see me. I'm very glad to see you. She said, yeah, when I come see you, I have to pay you $35. And I said, well, how much do you pay for your plan? Oh, well, she didn't know because her employer was paying for the plan. It was probably several $100s a month. And people like that sometimes came back when they found out they couldn't get an appointment for 3 weeks, and then it would be with a nurse practitioner, and they had a problem that they were worried about.
Right, certainly. So a physician that accepts cash from a patient is more reasonable, more efficient, more logical than your employer. Instead of paying you money, they hold back some of the money and they pay a giant corporate entity thousands of dollars, potentially a month, to give little bits of money in dribs and drabs to their physicians and their network.
Right, and to give big bucks to their CEOs and lots of money to the people along the way who are shuffling money around. And this does not make sense. And, of course, people are afraid that medical care costs so much that they couldn't possibly afford it. and the prices are going up, up, up. To find out what it really costs, though, you need to have somebody that posts the honest prices, like the Surgery Center of Oklahoma does. And this turned out to be revolutionary when they just posted the prices for a variety of services on their website. And patients were astonished to find out that their prices may be 20% or 10% of what other hospitals were quoting them as the price, which means that you have to ask, where did the other 80 or 90% of the dollar go? It certainly didn't go to the anesthesiologist or the physician or the facility that was providing the operating room.
So, but to back up one step, you were saying that the insurance companies decide how much the doctor gets paid, if the doctor gets paid, if they take the money back retroactively even years later, which medicine the patient gets prescribed, which tests get done or don't get done, what therapy gets done and what therapy doesn't get done. What business do they have in any of that?
Well, they're trying to save money, because what happens is when somebody else is paying the bill, demand for services goes up, up, up. The patients don't care how much it costs. The suppliers of the services charge as much as they can get from the insurance company. They never have to look a patient in the eye and answer questions like, how important is this test to me? What is there something less expensive? Could I wait a while? They never have to really give an honest answer to those questions. If it weren't for the insurance company, that we would practice differently.
Right. What about government intrusions into the exam room, into medical practice?
Well, these are the same as the insurance company, only really worse, because the government has the power to put you in prison if you write down the wrong code. And I know physicians who are in prison for things that used to be considered a little billing dispute. They have this complex billing system. They change the rules, bury in a 4-inch stack of paper that you get every month, and you can be accused of a crime if you overlook something. Or maybe less seriously, as one doctor asked me recently, he's being expected to pay $25,000 because he overlooked a change in their policy for paying for ultrasound treatments, and now he had to pay back all this money.
Right. So you're talking about Medicare and Medicaid, which are federal and state systems that are set up to provide insurance either by themselves or farmed out to private entities. And what about the whole movement in this country? There was a movement toward a single-payer system which didn't work out for President Obama, and they passed the Patient Privacy and Accountable Care Act, which people call Obamacare. How does that give the government a hand in and control of medical practice?
Well, it requires patients to purchase, quote, insurance, end of quote. What it forces them to do is to buy a health plan of the type that the government approves. And it is going to put out of business any insurers that offered the traditional kind of true insurance that was relatively low cost and left the patient in charge of things, and is going to be forced to buy something that's a whole lot more expensive. Or if you're poor, according to the government's definition, then they'll make somebody else subsidize the cost of your premiums. But it all boils down to the fact that everybody is going to be in one big insurance pool where these policymakers from Health and Human Services and other bureaucracies will be deciding who's allowed to get what.
So you're saying the downstream effect of all this regulation is that the government will ration care?
Well, exactly. How else are they going to control the costs that otherwise would go out of sight? They admit that they're going to have to do it.
Right. So you're saying insurance companies privately are trying to ration care by denying things to control costs, and now the government is involved by law in rationing and controlling costs and denying care services to people who need it or want it?
Well, exactly. That's what Medicare does. You know, all insurance companies supposedly can do is decide they're not going to pay for something. But when the government is involved, what rationing means is that you can't have it, regardless of whether it's available, whether you have the ability and willingness to pay for it yourself, or you can raise some money to pay for it. They will decide that you just can't have it because it's not appropriate, that resources should be spent on you. They should be spent in some way that's more valuable in their estimation.
So, in addition to the private insurers making these inappropriate decisions, the government will now be making these inappropriate decisions and deciding who gets care and when and who's denied care and when.
Right, and they can even criminalize your failure to adhere to their practice guidelines.
So you're saying that if people don't buy policies, there will be a monetary cost or a fine, and if physicians don't abide by these, they could be either fined or imprisoned?
They could be, or they could be booted out of the health plan that they're signed up with, or they can have their license taken away from them because they fell below the, quote, standard of care, end of quote.
Wow, that's pretty serious stuff. We'll have to think about that for a moment, and we're going to take a short break now and come back with more of Your Health Matters here on Rowan Radio 89.7 WGLS FM. Welcome back to Your Health Matters. I'm your host, local family physician, Dr. Craig Wax, talking about aspects of and the importance of the patient-physician relationship. Our special guest today is an internal medicine physician in Arizona, Dr. Jane Orient, who's also the executive president of the AAPS. Welcome back, Dr. Orient.
Thank you, Dr. Wax.
Oh, our pleasure. So far, you've really opened up our eyes, I think, to the importance of the patient-physician relationship and some of the intrusions that are inappropriate in medicines, both the private ones from private insurance and the government ones that are public and from public insurance, like Medicare and Medicaid. Let's talk a little bit, to backtrack a little bit about the importance of the doctor-patient relationship, just to kind of recap. You had mentioned 4 points in the early going.
Well, the patient is what medicine is all about, and the doctor should be working for the patient. He should be putting the patient's needs first. He should be committed to doing no harm to the patient in order to benefit the collective. And there really should be no entity, such an insurance company, between the patient and his physician. Otherwise, the physician cannot give his own honest, unbiased advice, uncorrupted by outside pressure.
Very good. I think you had said it very eloquently as well in the beginning, that doctors and physicians, I should say, should work for the patient or work toward the good of the patient, to do no harm, as in the oath of Hippocrates, to be subservient to no one, no private interests, no insurance companies, no government. Patient has to be number one in the exam room. And the fourth thing you had mentioned was the patient has the right to seek or decline the care that they receive, that they have the free will and ability to do that. And I thought that that was very, very important, that they don't have to have something that the government says they have to have, or they can't have something that the government says they can't have.
But they need to realize that they are really waiving that right, giving it up, when they give up the control over their own money and hand it over to the government through taxes or to the insurance company through their premiums. They should really be demanding a return to true insurance, which is just a way of sharing risk for catastrophic losses, instead of something that sucks up all of your money in return for a promise that's very often broken to give you what you need when you need it.
And I think that's a great point, because I was just going to ask you, my next question that I had just formulated was, what can patients and citizens of this great country do for themselves in order to get quality medical care from qualified physicians who work for patients, not for insurance companies or government entities?
Well, maybe patients should be, instead of asking doctors, do you take my insurance, which merely means, do you work for my insurance company? They should be asking, will you accept a self-paying patient?
I see.
And you're being a self-paying patient is good. It means that the prices are likely to be much more reasonable and that the patient is in charge.
Yeah, the patient needs to be in charge. And you're saying that there's a large group of physicians out there that actually accept cash as reimbursement and it's a reasonable rate that's determined in the free market and there's competition with it among other physicians and patients can bargain and negotiate?
Oh, yes. Now, I found, and in doing a survey of physicians in the Blue Book in Tucson, just calling them up and asking about this, I found that some of them are very puzzled if you can get through the menu to get through to somebody. They're kind of puzzled about somebody wanting to pay cash. But I found that virtually every person in the United States is able to figure out how to accept cash payment from somebody who wants to pay, although it's kind of an unfamiliar concept to them. But we do have a list of doctors on our website, aapsonline.org, who welcome cash-paying patients, and we invite more doctors to sign up for this. These are physicians who are willing to give patients their time, their attention, their best affordable price, honest, straightforward dealings, and make it clear that they know who they're working for.
Well, that's a very, very important point, I think, to make, that physicians need to work for patients, for the best interests of the patients, and patients should be the ones who decide on their care. They're going to do it, they're not going to do it, they want to go further, they don't want to go any further, they want to go in a different direction, because I think freedom and free will is what this country was founded on, and all of the rights that we believe are self-evident. This would be that relationship in a patient-physician relationship.
I think it's a very important part of our American freedoms. And another point you need to keep in mind is that as soon as you take money from an insurance company, you have to waive your privacy. You have to sign over permission for them to look at your entire medical record. And there may be some things in there that you would just really prefer to keep to yourself, or things that could really harm you if they fell into the hands of a potential employer, a disgruntled spouse, a blackmailer, or someone like that.
Oh, certainly. So privacy is also getting waived in the process, and you're recommending that people keep their privacy and they communicate directly with their physicians and reimburse their physicians directly at a reasonable, competitive rate.
That's what they should do, and they should. If their physician doesn't like to go along with that, maybe they should be looking for a different doctor.
Very good, Dr. Orient. I appreciate that information. If someone wants to get in touch with you, can you give us the information again and any other websites you think would be germane?
Well, our website is aapsonline.org. You can contact me through that if you like, Jane at aapsonline.org. Another website we recommend is takebackmedicine.com. You can sign up for our email alerts, and you can sign up as a patient who's interested in our freedom projects, and we can keep you informed about issues that are coming up.
Well, thank you again, Dr. Orient, for being with us today, talking about the patient-physician relationship.
That's my pleasure.
For this and more information, you can also go to healthisnumber1.com, spelled in words. You can email us with questions and commentary and things if you'd wish. We'll be happy to answer them at healthisnumber1, all spelled in words.com. That'll wrap it up for another edition of Your Health Matters here on Rowan Radio. Next week, we'll be back with another world-class guest and another eye-opening topic right here on Rowan Radio 89.7 WGLS FM.
You've been listening to Your Health Matters with your host, Dr. Craig Wax. This program is intended for general information purposes only. It is not a substitute for medical care. Please discuss this information and any questions with your family physician. Be sure to join us every Thursday at 5:30 p.m. for another edition of Your Health Matters on Rowan Radio 89.7 WGLS FM.